Okay, for landmarking for subcutaneous injections, we will do it in the back of the arms, in the abdomen, in the love handles, in the lower scapule, in the buttocks, and in the thighs. For intramuscular injections, we'll do it in the deltoid, where you feel for the process here. You put 3 fingers down, and right here, stick it in. And then for the thighs, it's the outer middle third. So you feel for the outer middle third, about right there. And so then for the vastus, or that's the vastus lateralis, for the ventrogluteal, you feel for the top of the femur. Put your hand and then turn about right there. And so then we are giving digoxin. So for digoxin, you have to do an assessment first. You have to check their vital signs and check the apical pulse. When you would give it, you have to, if the pulse is above 60 beats per minute, then you can give it. If you would hold it, if it was below 60 beats per minute. The 10 rights are, okay, so the 10 rights, the 10 drug rights are drug, dose, documentation, right to refuse, right route, right reason, evaluation, education, time and frequency, and the right person. So then documentation for, how many times you do your checks.
Yeah.
How many times you do your checks is you check the drug 3 times before giving it. You check it when you take the drug out of the cupboard. You check when you put the drug into the little cup, and then you check the label before you give it to the patient / putting it away. So then insulin. Okay, so for insulin, the test we have to do before we give insulin is we have to check our blood glucose levels. The normal BIT parameters for blood glucose levels is 5 to 10 millimoles per milliliter for normal and 5 to 12 millimoles per milliliter for frail elderly people. So to draw up insulin, first you have to, so you take your Humulin R and your Humulin N. So our order says 20 units of Humulin R and 10 units of Humulin N. So you take your cloudy, which is your Humulin N, and you have to roll it in your hands first. Yeah, make sure it's all mixed up. You take your alcohol swab and you swab the tops. You open up your needle. So I'm going to pull up 20 units and stick it into my R and push up 20 units of air into my R. And then I'm going to pull up another 10 units and push 10 units of air into my cloudy. And then I can go ahead and then just draw up 20 units of R. Make sure you always do clear and then cloudy. So pull up my R, pull it to 20, and then do cloudy. You always want to make sure you do clear then cloudy because if you pull up cloudy first, you're not going to be able to see the clear in it, so you need to make sure that you pull up the right amount of clear first. So you always do clear and then cloudy, and then I'm going to pull back another 10 units. There we go. Make sure there's no air bubbles. Yeah, we're good. So then you can cap it again and bring it to your patient. So bring it to our patient, okay? you also have to make sure that you double check, that you get your coworker to sign off to make sure that you've drawn up the right amount of insulin first. And then you go to your patient, you explain what you're going to be doing, and that you would give it into the back of the arms, right back here. So we're going to just inject it into our orange and pretend it's at the back of your arms. So you stick it in straight up and down at a 90-degree angle, like a dart. Right in, and then you just inject it slowly. Hold it, pull it out. After that's done, put the safety up into your sharp spin. Documentation for insulin is on the diabetic record. Okay, my client here is asking something for pain. So first, when they tell me that they need something for pain, I will ask them, where is the pain and can you rate it on a scale of 1 to 10? Once they do that for me, I would then proceed to go look in the MAR under the PRN page and the progress note to see when their last dose was. And so they have a doctor's orders for 5 milligrams intramuscular as needed. So then I will go and I will gather my supplies. So I will grab my ampule of 10 milligrams. I will grab my 3 milligram needle and you would grab a 23 gauge needle, but I don't have any of those right now. I just ran out. So I'm using a 25, but you would use a 23 in this situation, and your filter needle. So now I'm going to prepare. So I've washed my hands. I'm going to break open my ampule. It's open, put that in your sharps container. So then, now I'm going to take out my my syringe and open my filter needle. To take morphine, to take my morphine out, you have to sign it out of the NARC cupboard. And since that this is 10 milligrams and I'm only going to be using 0.5, you need to have someone sign out to prove that you are throwing out the rest of this. So you need to have someone double check and sign off for you as well. So now I'm just going to proceed to fill up my syringe with my morphine. So take the end off. You also want to make sure that you have a filter blunt needle on for if you break this for glass wise. You don't want glass getting up into your syringe. So I'm just going to draw up 0.5 now. No air bubble. Pull back to make sure that I get what's left of in there. Put on the cap again. Take that one off, dispose of it in your sharp spin. Take out your change needle. Put that one on. Pull your safety back. Take off the cap. And you're just going to want to push up till you see just a little dollop at the end. So now we have our morphine. We now come back to our patient. Cap back on. We come back to our patient and we ID them. So can I see your wristband? Okay, thank you. Can I get your name? Julie. Okay. So now we know who our patient is. We've confirmed that, so we're ready to give our morphine. So we'll be giving it into the deltoid muscle. So we'll just feel for the bone right here, and you'll go 3 fingers down. And on the 3rd finger, this is where you'll be giving your injection right there. So to give morphine, you put your hands there, and then you have to Z-track. So you'll push the muscle out of the way with your thumb, and then you would give them the injection right there, and then as soon as you're done giving the injection, you let it go, and that helps with minimal irritation. So after I've done that, I am ready to give my injection, and we're just going to be using this orange and pretending that this is her arm, the deltoid right there. So you're going to stick it in at a 90 degrees, straight up and down, in, and slowly push it in. Hold it for a second, take it out, give the safety, and safety precautions with morphine is you need to check, because morphine is a CNS depressant, so you need to check their respirations before and after giving it, because it can cause them to stop breathing. Policy and procedures you need to make sure with IM injections is you need to make sure that if you're allowed to aspirate or not according to your agency. And documentation since morphine is a PRN drug, you need to document it in 2 places, in the MAR, on progress notes, and on the PRN page. And when you're documenting, you need to write about how the procedure went and how your evaluation after you've given them morphine as well.